Sarcoidosis is a disease that causes tiny clumps of immune cells, called granulomas, to form in the body. These clumps can appear in the lungs, lymph nodes, skin, eyes, and even the heart or brain. Doctors do not fully understand why this happens, but they believe the immune system is overreacting to something, such as an infection or an environmental trigger. Sarcoidosis is more common in adults between the ages of 20 and 40 and is seen more often in African Americans and people of Northern European descent. Some people with sarcoidosis have no symptoms at all, while others may experience coughing, shortness of breath, rashes, eye problems, fatigue, or swollen lymph nodes. In many cases, the disease improves on its own. But for some people, it can become long-lasting and lead to serious problems like lung scarring or heart disease. Treatment usually begins with corticosteroids like prednisone, but these drugs can have side effects. Because of this, researchers are working hard to find better options. One of the most promising new treatments is a drug called efzofitimod, also called ADA 1923. Scientists discovered that a natural protein in the body, called HARSWEP, helps reduce inflammation in the lungs. Efzofitimod is designed to work in the same way, calming the immune system. Early trials showed it was safe and may be effective, and now a large Phase 3 clinical trial, called EFZO-FIT, is testing it in hundreds of patients worldwide. Another new drug is OAT01, which blocks an enzyme called CHIT1 that is often high in people with sarcoidosis. Since CHIT1 is linked to granuloma formation, lowering it could reduce disease activity. The FDA has allowed a Phase 2 trial of this treatment. At the same time, researchers are studying whether older medicines might work just as well as steroids. For example, the PREDMYTH trial compared methotrexate, an immune-suppressing drug, with prednisone, the standard treatment. Results suggest that methotrexate could work just as well as steroids but with fewer side effects. Discovering biomarkers. Another important area of research is finding biomarkers, or biological signs, that show how the disease is acting in the body. A study at Penn Medicine found that a type of immune cell called ILC1 is more common in sarcoidosis than in similar diseases. This discovery could lead to new tests to diagnose the disease earlier and track its progress. The Foundation for Sarcoidosis Research has also created a global patient registry. This registry collects information from patients about their symptoms, treatments, and quality of life. With more data, scientists can better understand how the disease affects different people and improve treatment guidelines. Other promising approaches. For people with skin sarcoidosis, studies show that drugs blocking the TNF-alpha pathway, like infliximab and adalimumab, and JAK/STAT pathway inhibitors, like tofacitinib, can help when other treatments don't work. Researchers are also working on better ways to diagnose and treat cardiac sarcoidosis, which can be life-threatening if not caught early. In addition, scientists at UCSF are running a study called Rise Up, which uses blood tests and clinical data to predict how sarcoidosis will change over time. This could help doctors know earlier which patients need stronger treatment and which may improve on their own. Looking forward. Although sarcoidosis is still a mysterious disease, research is bringing new hope. For decades, steroids were the only real treatment, but now scientists are testing new drugs, studying the immune system more closely, and developing better tools for diagnosis. These efforts could make a big difference for patients by reducing side effects, improving quality of life, and even preventing serious complications. In short, the future of sarcoidosis care looks brighter than ever before. With ongoing trials, global patient registries, and new medicines on the horizon, doctors are closer to giving patients safer and more effective options. Keep in mind that under the Trump administration they are cutting back on many new studies.